Medical field. Here are 10 academic vocabulary words commonly used in the medical field, along with their meanings and explanations. 1. Pathogenesis. Meaning: the development and progression of a disease or condition. Explanation: pathogenesis refers to the sequence of events that lead to the development and progression of a specific disease or condition. It involves understanding the underlying mechanisms, such as genetic, environmental, or immunological factors, that contribute to the disease process. 2. Etiology. Meaning: the cause or origin of a disease or condition. Explanation: etiology focuses on identifying the cause or origin of a particular disease or condition. It involves studying factors such as genetic predisposition, environmental exposures, infections, or lifestyle choices that contribute to the development of the disease. 3. Prognosis. Meaning: the likely outcome or course of a disease or condition. Explanation: prognosis refers to the predicted outcome or course of a disease or condition based on factors such as the patient's characteristics, disease severity, and response to treatment. It helps healthcare professionals communicate with patients about the expected progression and potential outcomes of their condition. 4. Epidemiology. Meaning: the study of the distribution and determinants of health-related events in populations. Explanation: epidemiology focuses on studying the patterns, causes, and effects of health-related events, such as diseases, in populations. It involves analyzing factors such as incidence, prevalence, risk factors, and outcomes to understand the occurrence and spread of diseases and guide public health interventions. 5. Pharmacokinetics. Meaning: the study of how the body processes drugs, including absorption, distribution, metabolism, and excretion. Explanation: pharmacokinetics involves studying how drugs are absorbed, distributed, metabolized, and eliminated by the body. It examines factors such as drug absorption rates, distribution throughout the body, transformation by metabolic processes, and elimination through urine or feces. Understanding pharmacokinetics helps determine the appropriate dosing and administration of medications. 6. Palliative. Meaning: providing relief from symptoms and improving quality of life, without aiming to cure the underlying disease. Explanation: palliative care focuses on providing relief from symptoms, pain, and stress associated with a serious illness. It aims to improve the quality of life for patients and their families, addressing physical, emotional, and spiritual needs. Palliative care does not seek to cure the underlying disease, but rather to manage symptoms and enhance comfort. 7. Double-blind. Meaning: an experimental design in which neither the participants nor the researchers know who is receiving the treatment and who is receiving a placebo or control. Explanation: in a double-blind study, neither the participants nor the researchers know whether they are receiving the actual treatment or a placebo or control. This design helps minimize bias and ensures that the evaluation of outcomes is objective and unbiased. 8. Randomized Controlled Trial, RCT. Meaning: a study design in which participants are randomly assigned to either the experimental group receiving the treatment or the control group receiving a placebo or standard care. Explanation: randomized controlled trials are considered the gold standard in clinical research. Participants in an RCT are randomly assigned to different groups, allowing researchers to compare the effects of a treatment or intervention against a control group. Randomization helps minimize bias and ensures that the groups are similar at the start of the study. 9. Informed consent. Meaning: the process of providing individuals with all necessary information about a medical procedure or study, enabling them to make a voluntary and informed decision. Explanation: informed consent is an ethical and legal requirement in medical research and clinical practice. It involves providing individuals with comprehensive information about the purpose, risks, benefits, and alternatives of a medical procedure or study. ensuring that they understand the information before making a voluntary decision to participate. 10. Meta-analysis. Meaning, a statistical method that combines data from multiple independent studies to generate a summary estimate of the overall effect. Explanation. Meta-analysis involves systematically reviewing and combining data from multiple independent studies on a particular topic or research question. By pooling the data, researchers can generate a summary estimate of the effect size, providing a more comprehensive and statistically robust analysis than individual studies alone. These academic vocabulary words are commonly used in the medical field, and understanding their meanings is essential for effective communication and comprehension in medical research and practice.